Okay, good morning, good afternoon, good evening po sa lahat. Saan man panig po kayo ng mundo naroon. Welcome to our 173rd, 173 episode of Stop COVID Deaths webinar series brought to you by the University of the Philippines. Thank you for being part of our credible online community at sa lahat po na nanonood for the very first time. Sana po ay masiyahan po kayo for today's webinar. Very, very exciting and I think probably one of the first times that we've had such an very, very subspecialized po na topic for today. So, we'll be discussing the ever-evolving landscape of pediatric surgical care in the Philippines, delving into comprehensive examination of the current state of pediatric surgical conditions and emphasizing the unique challenges faced within the Philippine healthcare system. So, for our episode for this week, we'll be tackling latest surgical techniques, innovative approaches, preoperative, postoperative pediatric surgical care. Special emphasis po kung ano po yung mga technologies na makabago, comparing po minimally invasive procedures, maybe even robotic surgery at in addressing pediatric surgical conditions po. And then finally, extending po ang discussion po natin to the importance of interdisciplinary collaboration to emphasize the role of teamwork in delivering optimal outcomes for young patients. I'm Dr. Raymond Francis Sarmiento, Director of the National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you during our regular Friday po. And for this Friday po, very, very special since we have today as my co-host po, no, the Philippine General Hospital's Coordinator for Training po, Dr. Marie Dion Sakdalan. Dr. Dion?
Good afternoon, Dr. Raymond, and good afternoon po to everyone, all our participants here in the live broadcast of Zoom webinar, and to all those watching live via live streaming on the TVUP YouTube channel, as well as on the UP System Facebook page, TVUP Facebook page, Stop COVID Deaths Facebook page, and of course, all those watching from TVUP Signal TV channel 101. So this afternoon, we are very much privileged to have a esteemed set of panelists, and we'll start off, and two of them are pediatric surgeons in the Philippine General Hospital, or even trained in the Philippine General Hospital. And we will be learning from them as we talk about operations for the pediatric population. So, Dr. Raymond, I know we have two pediatric surgeons, right? It's Dr. Esther Sagil.
So, Dr. Esther Sagil, who is, well, hindi niyo po natalang, she heads po our outpatient department at the Philippine General Hospital. Also, one of the more active po na consultants po natin, pediatric surgeon extraordinaire for us. And also, Dr. Rodolfo Tuazon Jr., Dr. Bong Tuazon, is the current president of the Philippine Society of Pediatric Surgeons po. So, bigatin po ang ating speakers for today and hopefully marami po kayo matutunan from them during today's webinar. Dr. Dion?
Okay, so as in the past webinar episodes, we've seen in the opening billboard, although we are still named Stop COVID Deaths, we are now expanding our discussions to the acronym that stands for COVID. So C stands for current COVID problems, O for other outbreaks, V for viruses, I for infections, and D for disasters. So we will be leveling up our discussions to take a closer look at our emerging or other emerging health problems in the community, while we keep an eye on still the COVID developments here in the Philippines and in the rest of the world. And since we know that you like to be current with the latest news in health and medicine here and abroad, we have a segment, as we have been doing it in the past, which we call News Updates.
Okay, thanks so much. For our very first news update, this comes in from the Department of Health po natin, where the DOH has been promoting or is promoting people-centered approach to drug abuse prevention and control with the Biyahing Kalusugan po, yung Claravan po program in Davao and Caraga. Recently, the Department of Health launched Biyahing Kalusugan Drug Abuse Prevention and Control Week event last November 20th in Davao Oriental and last November 22nd in Butuan City in Caraga with the support of its Centers for Health Development, local government units of Mati City, Davao Oriental, and Butuan City. And the United States Agency for International Development, or USAID, UN Office on Drugs and Crime, UNODC, the World Health Organization, Dangerous Drugs Board, the Philippine Drug Enforcement Agency, the DILG, Department of Interior Local Government, DSWD, Department of Social Welfare and Development, and the Department of Education, or DepEd po. Ito pong biyaheng kalusugan, Drug Abuse Prevention and Control Week na events po. These aim to engage communities in generating well-informed discourse. Pag-uusapan po about the harms of substance abuse, encourage supportive communication with peer groups and families, develop skills in dealing with peer pressure, and promoting adaptive coping mechanisms for stress and anxiety. Naghain din po ang Department of Health ng educational session to discuss the dangerous effects of drug abuse with a life size. Parang ano po talagang real life po, no, na anatomy model revealing ano po yung mga nakokos ng mga substances sa ating mga organs. Meron po rin po silang game booth to reiterate the call to say no to drugs. At meron din po silang sayawan, dance competition, to encourage student participants to explore healthier ways of self-expression and coping. Meron din pong art, community mural wall, and finally, a temporary canteen where all can eat lunch meals and talk with their peer counselors. Sir, the Department of Health is trying to foster community engagement, promoting mental health, and strengthening healthcare system to create a resilient society that stands united against the scourge of drug abuse. How about you? What's your news, Dr. Dion?
Thank you, Doc Raymond. So on our end, WHO has a statement on the reported clusters of respiratory illness in children in northern China. So the World Health Organization formally asked China for detailed information regarding a surge in respiratory illnesses and clusters of pneumonia in children. Chinese authorities attribute this increase to the relaxation of COVID-19 restrictions, allowing the circulation of various pathogens, including influenza, Mycoplasma pneumoniae, RSV, and SARS-CoV-2, emphasizing the importance of enhanced disease surveillance and strengthened healthcare system capacity. Chinese authorities reported the rise in respiratory diseases on November 13, so that's around 2 weeks ago. So a week after, reports surfaced of unexplained pneumonia clusters in children in northern China, with uncertainty about their connection to the previously reported increase in respiratory infections. The following day, WHO formally requested more information, including epidemiological data, clinical data, lab results, and trends in the circulation of known pathogens. WHO is now in contact with Chinese clinicians and scientists through existing technical partnerships. So while we're waiting for this additional information, WHO recommends that people in China take measures to reduce the risk of respiratory illnesses, including vaccination, maintaining distance from the sick, staying home when ill, testing and seeking medical care as needed, appropriate mask use, ensuring good ventilation, and regular hand washing. WHO promises to provide ongoing updates as they get more information. And that's it for our news updates.
Okay, thank you so much, Dr. Dion. Tuloy-tuloy lang po tayo. For our webinar for today, especially since marami po talaga yung nakaabang, ano po ba itong evolving management of pediatric surgical conditions po, no? Pero bago po tayo tumungo doon, we will now be introducing our person on the street video. Ito pong person on the street video po natin, or POTS as we like to call it, it's a 5-minute or less po na video to essentially gauge po kung ano po yung alam po ng common folks on the street on the topic at hand, ano po yung baseline na alam po nila sa pag-uusapan po nating topic for today. So really thank the hardworking team behind the TVUP team po and the webinar team as well for churning out this quality video po for the POTS week in and week out. For today's webinar po, no, ang mga tanong po natin sa kanila is as follows. May nakilala ka na bang mga batang naoperahan? May nakilala ka na bang batang nagkaroon ng appendicitis? At ano ang alam mong ginawa o ginagawa sa mga batang nadadiagnose ng appendicitis? Paano sa tingin ninyo ginagamot ang mga appendicitis at ibang mga sakit na kailangang operahan sa mga bata? Please watch this.
May mga nakilala na ako before, nung bata ako, nung high school.
Meron po.
Wala pa akong nakilalang batang naoperahan.
Wala pa po.
Madalas pag nagka-appendicitis, madalas sinoperahan, tapos ang alam ko parang tinatanggal yung appendix, parang
Usually, wala pa. Pero may mga mangilan-ngilan akong naririnig na nagkaroon ng appendicitis. Ang alam ko parang hindi maganda sa bata na magkaroon ng appendicitis.
Nakilala na appendicitis, wala pa, pero ang alam ko sa appendicitis is nagkaka-appendicitis ka kapag busog ka, tapos tumatakbo ka kaagad, ayun, nagkaka-appendicitis ka.
parang ang sinasabi nila pag magkaka-appendicitis, parang yung rule is dapat parang pagkatapos ng kumain, di ka agad dapat lalakad o tatakbo. Tapos madalas pag tinamaan na ng appendicitis, parang operation na agad yung ginagawa. Tinatanggal, tapos parang pahinga agad sa gumaling yung sugat.
Usually, nagkakaroon sila ng assessment. So, pwedeng mag-physical exam muna, and then pwedeng magka-lab tests or other procedures to check kung yun talaga yung diagnosis ng bata.
Usually, sa pagkakaalam ko, kapag may appendicitis ka, surgery agad yung parang treatment na ginagawa, na which is ang tawag ay appendectomy. Parang yun yung alam kong ginagawa agad.
Kapag may sign ka na appendicitis, kapag pumutok na yung appendicitis sa loob, ayun, operahan ka na agad.
Una, pag na-diagnose, siguro may mga lab test na ginagawa. Then after, siguro if ever acute na yung appendicitis, baka yun yung appendectomy.
Usually, nagkakaroon sila ng appendectomy kung saan tatanggalin yung appendix, and then better kung laparoscopic yung approach ka sa open.
Okay, thank you, TVE, for letting us know what people on the ground are thinking. Very interesting yung mga perceptions ng mga tao. And I remember when I was a little girl, sabi rin ng mother ko, pagkakain, bawal tumakbo at maglakad kasi
That's true.
magkaka-appendix ka. So we'll see, no? We want to clarify all these perceptions, and we are really excited to hear what our speakers will say about appendicitis and all the emerging techniques for surgery for the children. Dr. Iman?
Thank you so much, Dr. Dion. At yun nga po, kailangan din po na siguro ng more information. May mga, syempre, God forbid, may mangyari po, no? At least you know kung ano po yung mga options and at ano po yung mga kailangan yung itanong siguro sa inyong surgeon na o kung may o-operahan po na kamag-anak po ninyo. Something to get to know more about how to best manage yung pong condition na yun. Okay, so little bit of housekeeping for all those who are asking. Certificates of attendance will be given to those who have watched at least 50% of the webinar duration. Yung pong ating shortened URL bit.ly/stop COVID deaths webinar. Tapos kung ano po yung webinar number natin for today it's 173, next week is 174. Yun lang po yung ating registration link. So please let us know kung meron po kayong problema. May mga iba po kasi nahirapan daw po mag-register, that those are the ones that we've been able to see via email. So please let us know. If you also think or feel that you should have received a certificate but did not, please email us at stopcoviddeaths@up.edu.ph. For webinar today, we'll be having standard panel discussion format, and after our speakers have presented, that will be followed by a Q&A session. Okay? But before we delve into the webinar proper po, no, we'll just have a very, very quick and cute intro video for our fun quiz segment for today.
Hello? Hello? Hello?
Kumusta na kayo lahat?
Hi, I'm Doc Susie, the mini Doc Susie.
And I'm Doc Radar, the mini Doc Raymond. Are you ready to have fun? Simply open your browser to www.slido.com and enter your code to participate. We will discuss your answers during the panel discussion later on in the program.
We will have it flashing on your screen in a bit, and we look forward to your answers. Masaya at madali lang ito. Join na!
Okay, maraming salamat po, no? Can we have on our screen po ang ating Slido and then also yung ating Zoom poll po natin. Okay, there we go. Sabay po sila lumabas. For those who are watching us, whether sa YouTube po ng TVUP or sa Facebook pages ng Stop COVID Deaths o UP System or ng TVUP din po, you'll still be able to participate in our fun quiz by opening up your browsers, entering doon po sa address bar, you type in slido.com, and when you are prompted, you enter the code 6510096. That's 6510096 for you to be able to participate in our fun quiz segment. Makikita nyo rin po dito sa Zoom, meron po dito, may mga sumasagot na po. So we encourage you to answer ito pong dalawang mahirap, sobrang hirap na mga katanungan po natin. First question po natin, it's a statement. Ang statement po, true or false, any surgical operations or procedures indicated for children can be postponed until they are of school age. Okay? So, ulitin ko po, any surgical operations or procedures indicated for children, pwede po siyang i-postpone until they are of school age. Is it true or is it false? So, we'd like to greet those who are watching us from Air Force City Hospital in Clark Freeport in Pampanga, Santa Rosa Community Hospital in Santa Rosa, Laguna, UP Visayas Health Services Unit in Miag-ao, Iloilo, the Malay Municipal Health Office, Malay Aklan, DOH, Drug Abuse Treatment and Rehabilitation Center, Malaybalay City in Bukidnon, and Metro Davao Medical and Research Center in Davao City, in Davao del Sur. May mga nanonood din po sa atin all the way from Loma de Gato, Marilao, Bulacan, from University of Rizal System Health Services Unit po natin. RPHS, Annex 1, Antipolo, Dr. Menzi Ramos po. May mga nanonood din po from Tanay Rizal, from Los Baños, Laguna, from Diliman po natin, Quezon City, from the Philippine General Hospital. May manonood din po. May mga international po which I will greet later on. UST folks natin, maraming salamat po. For question number 2, ang question number 2 po natin, mahirap ulit. Yon! There are cases of appendicitis in children that can be managed non-operatively. May mga kaso po ng appendicitis sa bata na pwede po manage nang hindi po sila inooperahan. Is it true or is it false? So we'd like to greet those who are joining us naman internationally. So mayroon po from the University Hail in Hail's Kingdom of Saudi Arabia, New Sinai School and Colleges dito po sa may chat. Also from Los Angeles, California in the United States, Chonin Hospital in Taipei City in Taiwan, Canadian Medical Center, Dammam, Saudi Arabia, Lunichi Ali University of Blida 2 in Blida, Algeria, and Taif in the Kingdom of Saudi Arabia. So we will ask po ang ating speakers kung ano po ang katamang kasagutan din po sa dalawa pong katanungan na ito as we move on to our webinar proper. First speaker po, our main speaker will be introduced by Dr. Dion.
Okay, thank you, Dr. Raymond. Ang hirap ng mga questions, but I'm sure our guests and our participants have already answered it, and we'll know the right answers later on after the talks. No? So for our first speaker, she's a very renowned surgeon in the Philippines. Bagay po siya sa mga pediatric na mga pasyente. She's a consultant in the Division of Pediatric Surgery for the Department of Surgery in the Philippine General Hospital. As mentioned by Dr. Raymond, she's also the chair of the Department of Outpatient Services of the Philippine General Hospital for several years already. And I don't know how she's doing it. Please welcome our pediatric surgeon, first speaker, Dr. Esther Sagil. Good afternoon, Ma'am Esther.
Magandang hapon sa lahat, and I would like to thank TVUP for the very friendly invitation, no, to guest.
Yes, ma'am.
Alam nyo, napaka-importante ng pediatric surgery, ano, at napaka-kuunti rin namin. No? Kaya we know na medyo mababa ang kamalayan, as obvious with the question and answer kanina sa mga man
Opo.
on the street. So, itong ano natin, Raymond, you said kanina na marami mga high-tech, yung may mga robotic, laparoscopic, but I always say, alam nyo, kailangan, bago kayo mag-isip nun, kailangan alam nyo yung basics.
Tama.
Because sometimes, if you think that high-tech is the way to go, sometimes no surgery, no, is actually even better. Okay, so without further ado, I would like to start my presentation.
Yes, go ahead, ma'am.
Go ahead, Ma'am Esther.
So ang ating title ay, 'di ba, Bata-bata? Pwede ka ba ipa-opera? Ligtas ba? So again, I'm Dr. S. I'm primarily from PGH, and I'm a pediatric surgeon practicing for 25 years now. Okay, so the objectives of my talk are to introduce pediatric surgery as a distinct surgical specialty, to discuss common misconceptions in pediatric surgery, and to cite some updates in the management of common and important pediatric surgical conditions. So, ano ba ang Philippine Pediatric Surgery? In the Philippine General Hospital, the Division of Pediatric Surgery is a part of the Department of Surgery. It was created in 1969 pa. We have a formal 2-year training program, and this was started in 1981. Currently, there are only 5 training programs in the country for pediatric surgery. So ganun lang kaliit ang production ng pediatric surgeons every year. Napaka-important. And all these hospitals are government hospitals. 4 of them are DOH manned, and 1 is the Philippine General Hospital. At this time, there are only 74 fellows and 9 diplomates in active practice in pediatric surgery. Ilan ang isla ng Pilipinas? More than 7,000 tayo, no? So we know that there are areas that are severely undermanned. Wala silang pediatric surgical workforce. So bibigyan ko kayo ng profile of a pediatric surgeon. Mahirap mag-aral ng medisina, no? Magastos, matagal. So we should have passed the medical boards. Then you have to pass 5 years of accredited general surgery training. The training program of pediatric surgery only occurs after you've successfully hurdled general surgery training. Tapos, kung gusto mo pa magpakabihasa, you can add further training abroad or even master's and doctoral degrees. Mahirap maging pediatric surgeon if you don't like kids. You should like them even if they're crying and crying and crying, and even if they're not your own. I always tell parents of my patients that mahirap ako maging politiko kasi para patahimikin ko yung baby nila, I have to bribe them with candy or French fries or some play so that they'll be able to complete an examination or procedure. Mahirap din kasi maging pediatric surgeon kasi dapat approachable ka. You have to be able to display empathy and compassion to the pediatric patient. At tandaan nyo, ang pediatric is mahaba, mula baby hanggang 19 years old yan. But you have to keep a brave face for the adults. So there's a different approach when you are a pediatric surgeon. And lastly, dapat updated. Kung kayo mga updated sa mga adult and patients, updated kayo sa BTS, tsaka Korean novelas, kami naman updated kami pag animated series and cartoons, and of course, the ubiquitous Cocomelon. So what is the scope of pediatric surgery? Any person from the womb pa lang up to umabot siya ng age of 19 years belongs to the pediatric surgical age group. We're actually general surgeons for kids. So usually if it's orthopedic like fractures, joint replacements, if it's cardiac or neurosurgical, there are subspecialties for these cases. For us, it's mainly abdominal, gastrointestinal, trauma, soft tissue, inguinoscrotal, and oncologic or cancer cases. And amongst us, we feel that the most challenging really is fetal and neonatal surgery, and you'll understand later. There are so many misconceptions when it comes to pediatric surgery. In fact, sa clinics natin, whether it be in the service cases or even in private hospitals, ang daming takot na takot pa operahan. And you know what? This becomes a reason for delaying consult with resultant injury or damage or delayed in development in the child. So for example, laging tatanungin sa akin, baby pa lang pwede na bang operahan yan? Safe na ba? No. Usually, the most common case namin na elective is inguinal hernias or undescended testis, no? Merong 1-year-old, sasabihin, ay baby pa po, hindi ko pa ooperahan or worse, hindi pupunta sa doktor kasi ayaw niya talaga. Well, there are cases that need to be operated on while the baby is young or once they are diagnosed. And for hernias in children, the dictum is to operate on them as soon as they are diagnosed. For undescended testes, yung testes are not in the scrotal sacs, dapat magawa na yon by 1-year-old sila. Any undue delays in this surgery will have negative effects, definite, John. But we don't want them to be so bad, like bowel incarceration. Ibig sabihin nun, masakal yung bowel, or even masakal yung gonads, that's the testis or the ovary. We know that the misconception is probably due to fear. Obvious naman, talaga naman nagkakaroon tayo ng fear sa lahat eh. But I find that a lot of parents are very fearful actually, not of the surgery, but of the anesthesia. Siguro marami silang naririnig, no, or being passed on from relatives and peers, no, baka madali ng anesthesia ang naririnig ko name, or that the baby is too small pa. In smaller hospitals, yung absence of equipment that are fit for neonates and pediatrics are not often available, and nor is the trained workforce, and that may have prompted the advice. Yung mga nakikita namin galing sa mga outskirts or nearby provinces, they are told na antayin ang 7 years old, no? Ang 6 years old pagpapasok na, no? And pagka nag-delve ka talaga, marirealize mo na wala pala kasing trained in pediatric anesthesia or pediatric surgery do sa lugar na pinanggalingan nila, or the hospital does not have the equipment for this age group. Which is talaga namang importante din, no? Tama equipment mo. Kasi if you don't have the proper equipment, you're also exposing the child to possible complications. The second misconception is general anesthesia will cause intellectual deficiencies in the child. Ito, Tagalog niyan. Ay, mabobobo po ang anak ko. Narinig ko po, pagka ano po, pwede ho maging mahina ang utak kapag na-general anesthesia na. Which is so, nakakaawa naman kung hanggang ngayon ganun pa rin, ano? We are so lucky because the fact is, there are so many much newer, better anesthetic gases na kung mabilis mapatulog, mabilis din gisingin ang isang pasyente from anesthesia. There are also various techniques that have made pediatric surgery and pediatric anesthesia very, very safe. Noon dati kailangan lalagyan mo pa ng tube, yung endotracheal tube papunta sa trachea, no? Ngayon, pwede na yung dito na lang sa lalamunan, yung tinatawag namin LMA or laryngeal mask na lang siya. So, less na yung invasiveness of putting the anesthesia in. Yes, we know there are some cases where they have become problematic. Some cases have become problematic. And usually, kung magkakaroon man ng problema, it's because of absence or lack of oxygen. That's prolonged hypoxia. Because there are operations na talagang the child is critical, the patient is critical, and having oxygen is very important, no, to keep the blood flow into the brain. Pediatric anesthesiologists are very, very capable in handling the anesthetic needs of children. It is, however, a fact that there are some studies that suggest na those pediatric patients who undergo multiple, and the magic number is 6, major surgeries in early life occasionally show signs of hyperactivity or developmental delay. Pero these are cases where the cause is multifactorial, not the anesthesia, not the surgery, but the primary problem of a patient. Case in point, a patient with multiple congenital anomalies, like wala na siyang butas ng puwet, imperforate anus siya, meron pa siyang problema sa puso, meron pa siyang hydrocephalus. So, the more problems that the patient has, syempre, the more chances that there will be specific risks, no, per operation that's going to be done. But generally, single, one operation, two operations that last less than 4 hours, very, very safe ang mga ganyan surgery in the presence of trained personnel and having proper equipment. So what else is a common misconception? Madalas ginagamit na term is, na-clear na ba yung bata for surgery? No? Madalas sa akin natatanong yan. Pediatric clearance for surgery ba ensures that the surgery is going to be 100% safe? May analogy ako lagi dyan. Pag sumasakay tayo ng eroplano, pag sumasakay tayo ng bus, ng kotse, no? We're all in. We don't ask, safe bang pumasok dito sa bus? Safe bang pumasok dito sa eroplano? Okay? We don't like using anymore. Medyo sinantabi na natin ang use of clearance for surgery. What we now use is a more acceptable term that is preoperative risk evaluation. Usually, it is an internal medicine kapag pagka-adults, pag sa bata, yung pediatrician who gives the preoperative risk evaluation. For the Philippine Pediatric Society, the minimum tests that are asked for in a normal child, hati wala ibang problema, is at least a complete blood count, yung tinatawag natin CBC, and a chest x-ray. So additional tests are requested depending on the surgery that's going to be done and if there are other comorbid conditions that the child has. So it's the pediatrician or attending physician who assesses the patient. And I would like to emphasize that hindi dapat test lang ng tests, yung diagnostic test. Kailangan mo na mag-good detailed history in a child. Dapat maganda ang physical examination, hindi pwedeng kwento lang. And then you start asking for additional tests depending on what your findings are. So risk evaluation yan. So I'd just like to give you some updates on pediatric surgical conditions. Numero uno, nagkaroon tayo ng pandemic, 3 taon halos na walang tuli na nangyari at least sa Metro Manila. Ang totoo, I always get asked, kailangan ba talaga? Because I think most Filipinos will still, parents, will still opine that circumcision is a must. Okay? But ang totoo, there are only 3 medical indications for circumcision. Yung kailangan talaga. Number 1 is phimosis, that is retractive to steroids. Phimosis is masikip ang dulo. Paraphimosis, I'll just show you a picture, and recurrent UTI, lalo na sa mga lalaki na nagkaroon na ng UTI. Otherwise, the advice for getting circumcision is primarily one, it's elective, it's culture mandated, and ang main benefit actually is sa WHO is hygiene, which is important when it comes to developing penile cancer. And this is more commonly a recommendation in Africa where the risk for HIV is very high. No, tsaka medyo polygamous yung kanilang society. But otherwise talaga, elective lang yan. Sa atin, ang cultural natin is kung hindi na, usually pagka medyo affluent society group, naghahingi sa neonatal. Pero pag yung regular Filipinos, they will ask for the circumcision sometime in the early teenage years. So ito ang medical indication. I hope you see my pointer, but you see the very, very small opening outside and then magbabaloon. Pag every time magwiwiwi si baby, nagbabaloon yung dulo nito. So there will be, may matitirang wiwi sa inside this area. And that makes the child very prone to UTI. And we don't like UTIs in children or even adults, by the way, because any UTI will cause damage to the kidneys later on. Ito naman sa second picture, this is known as paraphimosis. This little band that I'm showing you with my pointer is actually the result of a child na either one, nilaro kasi nangangati, so niretract na yung skin, tapos di niya mabalik. Nasasakal. So pamaga ng pamaga yung balat sa dulo. Until sa such a time, napatin siya, hindi na siya makaihi at saka very painful to. In the hospital, sometimes this occurs during catheterization. So pag habang nag-insert ng Foley catheter na tinatawag natin sa urethra, nire-retract nila yung skin. Nakalimutang ibalik yung skin. So masasakal yung penis. It's very, very painful. Then an emergency circumcision is necessary. So yes, it can be done in the neonatal period very safely or anytime thereafter. So it's a misconception also na hindi pwedeng magtuli pag 5 years old, 6 years old. It can be done anytime in lifetime kahit ikaw ay adult na. No? Sa atin, medyo may cultural significance lang yung parang transition to manhood, yung circumcision. But the battle cry of pediatric surgeons and pediatricians is, bukod dun sa pagpapatuli, make sure that the procedure is performed by a qualified and trained health professional under strict aseptic conditions and with proper effective anesthetics. Bakit natin sinasabi ito? May mga nagpapanggap. I think circa 1959, 60, merong neighborhood taga-tulay, di ba? Pukpok method ang tawag natin doon. Tapos tatalon daw sa tubig, sa ilog or sa dagat. Well, lagpas na tayo doon eh. Medyo mas gusto na natin ng safety. We get a lot of requests, no, to perform Operation Tuli. And I have all the horror stories. Now you do the tuli in the circumcision in classrooms, in basketball courts, tapos hindi naman properly sterilized yung gamit, hindi rin qualified o hindi naman talaga trained yung health professional gagawa. Tapos ang pinakamasakit pa, howling success. The child is screaming and screaming and crying, which is very traumatic, diba? It can even qualify as child abuse. So we don't want that. We want somebody, if you're going to get your child circumcised, have it done by somebody who is trained, who will do it in good medical conditions, na asepsis is going to be observed, and with effective anesthetics. Sa totoo lang po, nasanay sa atin na nagbibigay ng oral antibiotics after doing a regular circumcision. But as sa totoo po, it's supposed to be a clean operation and antibiotics are not even needed. So this is part of our battle cry for antimicrobial stewardship or yung tinatawag nating proper rational use of antibiotics. Bakit tayo salita ng ganito? Kasi may mga komplikasyon tayo nakikita. By the way, hindi lang naman sa atin, kahit sa Malaysia, nagrereklamo na rin sila sa dami ng komplikasyon. They're often correlated with improper assessment. May iba palang sakit yung bata, like a bleeding problem. There was a landmark case 2 years ago in a province. The patient bled because hindi natanong na meron palang bleeding problem. With an improper technique, natabaan yung malaking nerve or na-bite pati yung ulo ng penis. Or poor aftercare, hindi marunong o hindi naturuan maglinis. So I'll just show you 2 examples of things that can happen with circumcision. The first one is naalala niyo yung tinatawag natin na ngamatis? Well, this is it. When you do a tuli, yung tinatawag natin na dorsal slit, no removal of skin is done, and lo and behold, no, mahaba yung kanyang prepuce o yung skin, and the patient is not advised how to do the dressing and how to properly position the penis, and it can get really, really maga. No? That's lymphedema for you. Generally, it will resolve in 1 to 2 weeks, but I have seen several cases where because of the huge size, hindi na bumabalik and we have to do a reduced circumcision, which is so traumatic for the child, by the way. The next is an infection which is incurred in a circumcision that was done in the operation tuli, yung mga mass tuli. So it's a plea na walang masama sa operation tuli. We're helping children get something that they want to have, but it should be done in the proper milieu and with trained professionals. So how about naman inguinal hernias? Natatanong ako, babae ho anak ko, bakit ho may lustos? Di ba sa lalaki lang yan? Unfortunately, meron din ang babae. No? It's congenital in children. It's indirect inguinal hernias and malaki ang chance na malaki. 9:1 yan. Kung may 10 batang may hernia, isa lang babae ang meron doon, 9 ang lalaki dyan. It's very common in premature infants. Kasi nagsasara lang yung butas na yan na pinaglalabasan ng hernia around 32 weeks. Something like mga 7.5 to 8 months sa loob ng tiyan. So if you have deliver a child who's 6 or 7 months, malaki ang chance niya na meron siyang hernia. Unfortunately for hernias, particularly in infants, infant is until 1 year old, there's a very high risk of incarceration or maipit. And when there's something maipit, masakit. But apart from masakit, bakit ba sumasakit? Kasi naiipit yung intestines or yung kanyang gonads, whether it's the ovary in the female or the testis in the male. Ideally, hernias in children should be operated as soon as diagnosed. Kaya lang naman kami minsan nagde-delay is there may be some other more serious anomalies that have to be taken care of. Like for example, a major cardiac problem. Hydrocephalus, yung mga major na mga problema sa katawan, or may major liver problem siya like biliary atresia na kailangan din i-address yung kanyang liver problem. At ang maganda pa dito, hindi naman laging kailangan ina-admit, no? Dito sa Pilipinas, we do outpatient surgeries for hernias and simple surgeries if the patient is already at least 6 months old. The term actually is 60 weeks post-conceptual age. Kasi kahit premature ka, by the time umabot ka ng 6 months old, okay ka na, mature ka na. Bakit? Kasi merong mga anesthetic complications or risks kapag ka premature. No? Yung mga tinatawag namin post-op apnea, no, na binabantayan namin. And these are highest in the first 3 months of life. So to make it very safe, we use 6 months old as the benchmark. In the Philippine General Hospital, since 1985, ginagawa ng outpatient surgery in children. As long as walang major comorbidities. Asthma, mild asthma, controllable with inhalers, are already can be done. They can be done in the OPD. So ito lang ang picture ng isang hernia na pag umiyak yung anak nyo, merong nagbabulge dito sa tinatawag nating groin or inguinal area. Yan ang laman niya dahil nagtagal sila, 2 araw sila sa bahay bago lumuwas bago pumunta sa ospital. Look at the intestines. It will become gangrenous kasi naiipit siya inside here. And the worst part is, this is intestines, but you see, there's also a testis here. And the blood supply of the testis also courses through this area. So unfortunately for this child, even the testis became compromised, and we had to take out both part of the intestine and this right testis. So di ba disastrous? Samantalang kung pinaoperahan niya yan ng elective, outpatient lang sana siya. No? 1 oras lang operasyon, tapos papakainin at uuwi na. So we want to emphasize this because sometimes sa sobrang takot, no, we're galvanized into inaction. And we don't like inaction. We like proactive behavior, particularly when it comes to the health of children. How about undescended testes? Unfortunately, again, pag premature ka at lalaki anak mo, there are cases, no, that the testes can be not absent in the scrotal sacs. Sometimes it's just one side, other times it's bilateral, and they can be part of more complex intersex anomalies. Thankfully, pwedeng bumaba. And it still occurs. Minomonitor dapat yan. Na hindi yung, ay, pinanganak ang baby mo, nakita ng doktor, ay, wala siyang testis. Sasabi mo, okay, babalik kayo, 7 years old na. No. This has to be monitored during the first few months of life. Because if there's no significant descent after 6 months, we already recommend surgery. Those are the current guidelines. It has already been documented histologically. Ibig sabihin, chinek talaga sa microscopy that spermatic damage is already documented if the orchidopexy or the surgery is delayed after 18 months of life. So yes, lalaki yung anak mo, pero sayang naman yung sperm. So kung may plano ka maging lola, baka hindi mangyari. Kung plano mo maging lolo, baka hindi mangyari because of the delay in surgery. So napaka-importante na merong mga time-sensitive na surgeries kasi these are among them. So I just wanted to show an example of undescended testis. So kitang-kita na walang laman yung scrotum. So particularly for the parents na hindi sigurado, walang masama magtanong, always ask. And in the first year of life, please have monthly checkups in the health center or with your pediatrician or with your doctor. No? Kasi minsan meron tayong hindi napipick up There are some naman na ganito yung tinatawag na ambiguous genitalia. So eto, wala kayong nakikitang testis, no? Pero parang maliit. These are important at alam nyo ba, dito nakatulong ang newborn screening because these cases are associated with congenital adrenal hyperplasia. So may ibang surgery ginagawa para dyan. These are very important conditions pero problema din to kasi pagpapangalan ng bata. No? Minsan kasi akala, ay lalaki bibigyan ng male name tapos only to find out pag nag-chromosomal analysis, female pala siya. And that can give you a lot of problems lalo na sa school at sa NBI at saka sa lahat ng clearances nyo. So, I'd just like to highlight some non-operative management of common surgical conditions. As early as the 1990s, no, we knew about non-operative management of intussusception. What's intussusception? It's a condition that occurs in healthy babies. Usually, ang age niya 4 months to 2 years old, na parang masakit ang tiyan. There seems to be some abdominal pain. The child throws up and comes out with bloody stools. We call the bloody stools in the books currant jelly stools, but siguro sa atin, melted strawberry jam ang itsura niya. It's small intestines that go into the large intestines and ano ba naman kung pumasok, but that leads also to gangrene of the bowel kasi naiipit yung blood supply ng bowel. And thankfully, if recognized early, ibig sabihin, pag pumunta ng maaga sa health professionals sa emergency room, we can still do non-operative management. However, once intestinal obstruction, barado na yung bituka, ibig sabihin, ang laki na ng tiyan, o kaya lagnat na ng mataas, masakit na yung tiyan pag pinapalpate, then surgery becomes mandatory. Oh, napaka-importante ito. You know why? If you read Western books, sasabihin sa inyo na ang hydrostatic interception management is 87% successful. Alam nyo ba, baligtad ang statistics natin dito sa Pilipinas? 87% is surgical and 13% becomes successful sa non-operative management. And you know what the reason is? Delayed consult, delayed intervention. The more common kasing cause sa Pilipinas for bloody stools is infection. So sometimes those who are not aware, yung malayo sa kamalayan nila ang having interception in this age group. Akala nila, baka na kainom lang na maruming tubig, amoeba. The typical sa atin is amoeba. Bibigyan ng antibiotic for amoeba, iuuwi ng nanay yung pasyente. Babalik the next day, toxic na. Kawawa yan kasi pwede maputulan ng bituka and worse, kapag talagang bad infection, pwede din nila ikamatay yan. So importante yung recognition. This is how it's done. Through a tube inside the anus, this is the intussusception in the second film, napupush nung fluid na pinapasok. Pag nakita na namin, so yung buong loop na ito, yan ang colon. Pag pumasok na sa small intestine, ibig sabihin nun, okay na. No? Nagawa na namin na twist na namin, nalabas na namin yung nakapasok na bowel. And that is success para sa isang magulang. Hindi kailangan operahan yung anak niya, makakauwi agad sila. Pagka late na tayong pumunta, ito yung nakikita sa operation. The small intestine goes inside the large intestine and we call it reduction, ilalabas namin. Pag hindi na kayang lumabas or nailabas pero nakita natin na bulok siya, then we have to take out the bulok segment. And then, na-imagine nyo kung ano yung the child will have to go through. Matagal ang guto, matagal na antibiotics, long hospital stay, when it could have been avoided if we had gone to the hospital early and the condition was recognized. So these are very important conditions in children. How about trauma? Napaka-common yan. I'm also in trauma. I also manage trauma. And we know that children, they're so trusting. No? Kaya ang dali nila, akala nila si Superman sila, si Batman sila. They commonly get injuries from falls, vehicular crashes, whether they're passengers, nakakandong, di ba nausap pa may child seat. May child seat ba ang jeep at saka tricycle? No? Marami din tayong batang pedestrian or naglalaro sa kalye. Kaya marami talaga tayong points for improvement na pagdating sa child safety. Sa mga wala naman tayo kung konti lang ang playground sa Pilipinas lalo na sa Maynila. As early as the 1990s, it was already recognized that solid organ injuries can be managed non-operatively. Children's pediatric surgeons were the first to notice this. Sumunod na lang ang mga adult surgeons. However, hindi pwede sabihin, hindi, pwede non-operative. You have to be some available things. No? Number one, you have to be reliable and prompt imaging modalities. Ano ibig sabihin nun? Meron kayo dapat magaling mag-ultrasound, magbasa ng ultrasound, whether it's a surgeon or radiologist. You have the CT scan. Yan ang mga titawag na mga imaging. Kasi pwedeng may CT scan ka pero after 2 days pa gagawin, na-aksidente na ako ngayon eh. Hindi pwedeng aantayin mo yung 3 araw, 2 araw. So it has to be prompt, readily available. Number 2, presence of blood products. Kasi the most common problem with having an abdominal trauma is bleeding from the solid organs, the liver, the spleen, the kidneys. Dapat meron din critical care capabilities kasi kailangan marunong team approach ang pag-handle ng children, lalo na kapag medyo critical, yung medyo mahirap-hirap severe injuries. So you have to have the specialists in trauma, anesthesia, and of course the others pa, yung surgical team natin, kung pwedeng may radiology din. Just some examples, the liver can be injured in trauma, yung mga nabundol. Lalo yung mga lap belt, meron din yung mga ganyan. So, noon dati, pagka ganito na nakita sa CT scan or nakapa mo sa tummy, sa physical examination mo na, ay masakit, kailangan na operahan to. Not anymore. if we have the proper capabilities I mentioned earlier, pwede natin 'tong antayin. Mabait ang dugo, eh. Pwede siyang mag-clot. Kaya chine-check natin lahat yung clotting, yung coagulation profile na tinatawag. If the patient is stable or nabigyan mo lang ng fluids, nag-i-stabilize siya, normal ang blood pressure niya, hindi mo siya putlang-putla, we can manage this non-operatively. So, mahaba ang PC namin sa pag-opera as long as hindi pumutok ang bituka. Basta ang injured lang, nabugbog or may contusion ang spleen, liver, pancreas, kidney, even the duodenum, no? Pwede nating ma-manage yan without surgery. Kaya kami, minsan hindi naman actually surgery ang ginagawa, pati yung critical care component, nakatutok din kami. So I now go to yung tinatanong kanina doon sa man on the street question. So what are the most common problems you know about appendicitis? So I think in contrast to the previous hernias and hydrocele na elective, appendicitis is an emergency. And it's technically the most common surgical emergency. Abdominal pain is also the most common reason for going to an ER for a child. The peak incidence is in the first 2 decades of life. Pag mga 6 years old, 7 years old, 13. But mind you, it can also occur in the 1, 2, 3 age group. And that's the problem, where the problem lies. These young children cannot verbalize where the abdominal pain is. And know what the problem is in this age group, 100% ruptured ang kanilang mga appendicitis, which is very, very sad. Those are statistics coming from Canada and in the US. Kaya dapat mas mabilis ka rin humingi ng mga test kung hindi mo makausap ng maayos because the child is still nonverbal or there are conditions in the child that prevent him from communicating well. We have children with special needs. No? Meron tayong may mga deaf mutism, meron tayong may mga autism, may developmental delay. These are special kids na kailangan natin na mas maaga tayo mag-contemplate in asking for imaging. In developed countries, it occurs at the rate of 5.7 to 50 per 100,000 inhabitants. And as I think everybody knows that the gold standard, kailangan mong tanggalin ang namamagang appendix and the surgery is known as appendectomy. Most know that it can be done open. Open means may hiwa talaga. No? Makikita talaga appendix. But nowadays, laparoscopic techniques can be utilized. And in several hospitals already, I know that appendectomies can be done very safely. Nung una nga, sa uncomplicated appendicitis lang ginagawa ang laparoscopic. But now, even with ruptured appendicitis, as long as the patient is stable, laparoscopic techniques can still be done. So that's how an appendicitis looks like. So look at the first picture on the left. This is an uncomplicated appendix. It's malaki, dilated. The appendix marks the site where the small intestines joins the large intestines. So this is appendix before it's permanently going to be removed. And notice there's a bulge here in the middle. That's where the usual source of the cause of the appendicitis is. And it is a small, hard piece of feces or stool. So yung sinasabi sa atin na matatanda na huwag kang tatalon pagkatapos kumain, no? Hindi naman actually sa tama. Kahit magtatalon ka, kung hindi naman siya pupunta. At importante pumunta siya doon, tapos ayaw niya na makalabas kasi maliit yung base eh. So minsan nakamaling pumunta doon, mapuwersa sa dulo, tapos hindi na siya makabalik. That is the main cause of appendicitis. It's zone sa fecality that obstructs, causing inflammation, infection, because remember, pupo has a lot of bacteria. And on the right picture, this is a case of a ruptured appendicitis already, where the fecal material, that's where the stone is seen perforating the middle part of the appendix. No? Ito yung salarin sa naglalagay ng maraming an abscess or nanat sa loob ng tiyan. And we know it can cause peritonitis, and this can be very deleterious to a child. We know also that we have appendectomy scars. If you have a thin patient, you can have a small scar. We now close scars. Most surgeons will close the incision with what we call absorbable. At Tagalog natin natutunaw. Pero actually, hindi siya natutunaw. Na-absorb siya. Kinakain siya ng white blood cells yung suture. Pag medyo malaki, no, mas makapal yung subcutaneous tissue mo, yung abdominal wall mo, pag nag-open surgery, medyo mas lalaki yung incision mo kasi mas malalim para makita mo yung appendix. But take a look at laparoscopic surgery, and that is why it is the fad, particularly mga artistahin, no? Yung mga ate ayaw magkaroon ng problema kasi magbibikini sila. We have very small incisions. There are still incisions, by the way. One is here in the umbilicus, and two are in the lower part of the abdomen, do sa puson area. So, kung pag kinumpare ninyo, talaga naman scar-wise, merong superiority ang laparoscopic surgery. So, ang isipin mo na lang is, meron ka ba na equipment? You have the support staff, no? In general, appendicitis for teenagers we can do under spinal anesthesia, pero pag nag-laparoscopic appendectomy kami, general anesthesia na. So, may cost din at saka anesthesia differences between open and laparoscopic appendectomies. Pero meron ding non-operative management of appendicitis ngayon. And this is a major innovation and breakthrough. Actually, a lot of controversies pa nga ito eh. Studies were shown, sa Europe nagsimula yung movement for doing non-operative appendicitis, management of appendicitis or NOM, which was started sa mga studies in 2012 for uncomplicated studies. Ang standard is you have to confirm the presence of appendicitis by imaging. So that's either an ultrasound or a CT scan, after which the patient is started on intravenous antibiotics. If the pain, fever, resolve, pain, sabihin ng pain, sabi ng pasyente na wala na yung sakit. Pero dapat pag pinindot mo, wala ring masakit. Tenderness yun, pag pinipindot may tenderness. You can allow discharge after 2 to 3 days of IV antibiotics once these symptoms resolve. But the patient will be sent home on oral antibiotics. Matagal na naming sinasabi na pwede nating i-try ito for select individuals, for select patients. But you know what? It gained widespread adoption during the COVID pandemic. Remember, there were so few beds. No, so many people were scared going to the hospital, staying in the hospital. Even surgeons were scared to go to the hospital. So madami nag-adopt temporarily at least during the pandemic, nung kasagsagan ng pandemic. So how do we do it? Well, there's been a systematic review already of all evidences for NOM. For uncomplicated lang to, unruptured muna to. And these are known as the Jerusalem Guidelines, published in 2020. There were 13 studies, 4 retrospective, pero 4 prospective, okay, 4 non-randomized, and 1 was an RCT. So medyo maganda-ganda ni evidence natin, madami-dami na din ang evidence natin for NOM. What does it say? Based on the results of the review of non-operative management, it can be suggested for selected pediatric patients presenting with uncomplicated, unruptured, ibig sabihin nun, appendicitis. So, sino ang qualified based on the systematic review? 1, imaging confirmed uncomplicated appendicitis. Ito yung mga findings na hinahanap. Hyperemia, sabihin maraming blood supply doon kasi namamaga siya. Fat stranding, meron ng fibrin sa paligid. Malaki na siya. The usual appendix is 0.6. Pag 0.7 siya of a centimeter, malaki na siya. So hanggang 1 to 1.1 centimeter, okay. Pag 1.2 na siya, ibig sabihin yan near rupture na yan, hindi na siya good patient for NOM. There should be no abscess, no phlegmon, wala pang tissue reaction, and there should be no fecal leak. This is a major nag-try. We tried doing non-operative management of patients with fecal leak, and usually sila yung nagpe-failure of management. The white blood cell count should be between the range of 5,000 to 18,000. We go as high as 20,000. Now, this is very important, the imaging confirmation. We in pediatric surgery, those in pediatric ER know that we have patients who were sent home with a wrong diagnosis of UTI, gastroenteritis, and the patient turned out to have appendicitis later. They were given antibiotics orally and sent home, and they come back 2 to 3 days later, already with periappendiceal abscess or worse, peritonitis. And that's because walang image confirmation hindi nila na-check talaga na hindi appendicitis yung sakit. There have been deaths that have occurred in that manner. So that is why we're also very careful, because this is a novel way of managing appendicitis. So we want the child to be very safe. That's why we need confirmation that the appendicitis is still uncomplicated. Because once complicated na siya, your chance of getting good results are very, very low. Sino yung hindi qualified? If it's chronic abdominal pain, monthly, nag-check pala siya, nagkakaroon pala siya ng admissions, that means you don't know. And you really have to investigate na whether through imaging or through laparoscopy what the cause of the abdominal pain is. If you already have what we call an acute abdomen on physical examination, if the patient is pregnant, there's a fecal leak, or there's already evidence of a perforated appendix, NOM is not anymore recommended. Yung last natin, what was I was elucidating earlier, if you cannot communicate with the patient. No, unfortunately, meron tayong ganun mga pasyente na mahirap na malaman kung gumagaling sila o hindi, no? And in these cases, it is so much safer to perform the appendectomy rather than wait. So early on, there was a lot. Mataas yung failure rate. These are the earlier failure rates are as high as 60%, the NACA reported at 47. But later on, mga 2018, the success rate was as high at 1 year old na. When we say success, walang recurrence. Gumaling, hindi siya na-operahan during the same admission, and then hindi siya dapat nag-recur within 1 year. The success rate is 65 to 80% at 1 year, and the recurrence rate is as high as 31%. The lowest is 0.1. We see rates generally in the 14 to 30%. So ano ibig sabihin pag nagre-recur? Baka may iba siyang problema. No? Kasi there can be tumors in the appendix. So will you try non-operative management again? Medyo malabo ang sagot ko. Sabihin ko sa'yo, wag na kasi ulit lang na ulit. Eh. So in PGH, we've already been trying out NOM, and these were our cases in 2022. Referral center lang ang PGH. No, saka hindi kami nakakatanggap masyado na maraming appendicitis because of, I think most of laging puno yung ER. So we only performed 26 surgery for uncomplicated appendicitis and 67 for complicated. So notice, ang daming complicated. We do laparoscopic appendicitis quite often already. Okay? Percutaneous drainage is done for those with abscesses. But we did non-operative management, 34 cases last year. And thankfully, wala kami nag-fail doon sa 34 na pinrasid namin non-operative management. Walang bumalik with a recurrence. So we know that in select patients, it is possible. Oh, sir, tinan nyo kasi, all operations have potential complications, anesthetic complications. Pag yung to the surgery na itself, bleeding and infection lagi ang problema mo dyan. So if you can recommend something, kaya importante yung early sila dumating eh. Kasi pag maaga sila dumating, you can offer. Pag late na, wala na surgery na talaga re-recommend natin. Okay? So, what we can say is non-operative management for uncomplicated appendicitis in children is feasible, it is effective, particularly for initial treatment. Pero, kung merong fecal leak at merong recurrence of pain, then surgery should be recommended. So, NOM should be discussed with patients and caregivers to advise na we will try it out. It can fail, mababa lang, but it can fail, and we don't want to misdiagnose complicated appendicitis. The other thing is tumors, cancers can also occur in the appendix. So we don't also want to misdiagnose or have delayed diagnosis of these rare but important conditions. So, ang final papakita ko lang sa inyo, matindi ang aming spectrum. So we also do conjoined twins, but this is the subject of another webinar altogether. So with that, I would like to summarize my talk. Surgery in babies and children can be performed safely as long as the individuals, the professionals who take care of you are trained and there's proper equipment. There are always constant endeavors to lessen the trauma of surgery because surgery is stress through less invasive approaches, improved pain management, and of course, better psychosocial support. The safety of children is paramount, as you keep on hearing in Ukraine and in Gaza, and every measure should be taken to ensure that the risks of surgery and anesthesia are minimized. To quote our favorite non-pharmacologic management of pain and crying in children, safe and alaga ang bata kapag ang nag-aalaga ay pediatric surgeons. So with that, thank you so much for listening.
Okay, thank you so much. Malaman po yung talk ni Ma'am S, and really appreciate po the photos that we got. It's not really often that we're able to visualize po yung pinag-uusapan po natin. Thank you so much, Dr. Sagil. Comments from Dr. Dion.
Well, now you know why Ma'am S is one of the well sought of pediatric surgeons in the country, no? Napakabait, napakapasensyo siya sa pag-explain sa mga tungkol sa mga konsepto na ito, and that's why our parents are very appreciative of how they talk about the disease, what's wrong, and what can be done. So marami pong salamat, Ma'am S. Ako rin po, marami rin po akong natutunan. Much as I'm sure our attendees have learned a lot from the lecture on pediatric conditions and its surgical options. So we will hear more from Dr. S. Sagil in a while during the question and answer segment of our webinar. And I think it's about time that we call in our reactor, Dr. Raymond.
Yes, thank you so much. Thank you so much also to Dr. Sagil. Our reactor today is none other than the current president of the Philippine Society of Pediatric Surgeons, Dr. Rodolfo Bong Tuason. Dr. Tuason, go ahead, sir.
Afternoon,
Magandang
Dr.
tanghali
Tuason.
po. Magandang tanghali po sa inyo lahat. No? First of all, I would like to congratulate Ate Esther Sagil, no, for that very comprehensive and thorough discussion about the surgical conditions, no, in children, and those who are operable, and for those procedures that can wait, okay, or can be monitored conservatively. Okay, and of course, thank you, Dr. Raymond and Dr. Dion. No? I can remember Dion during my fellowship. Na she's one of our rotators during the time. Medyo matagal na po yan. And of course, I can also vouch for what you have mentioned about Dr. S. Dr. S is such a very good lecturer, no? At talagang magaling mag-explain even to not only to the patients, no, but also to our residents, to our fellows, no. Okay. She's my ate. After her fellowship, ako yung sumunod. So she was able to discuss earlier the training of our fellows, no, the hardship of being a medical student and everything, no. So that's why it's very important for us, no, to our audience, our listeners, really to understand, no, what are these particular diseases, especially in pediatric surgical conditions that can be managed as emergency and that can be managed conservatively. So again, thank you for TBUP, no, for the invitation. Okay. Regarding the particular diseases that were mentioned by Ate Esther, regarding the circumcision, okay, and I believe that circumcision is not really a dekahon, hindi po siya yung talagang kailangan gawin, no. There are really indications for performing that, and in other set of patients who are really quite very familiar, no, or quite aware na pwede bang gawin ang neonatal circumcision, no? Pwede ba yon 1 or 2 days or a day before discharge of the baby? So again, Dr. S mentioned about the indication, no, yung phimosis, paraphimosis, and recurrent UTI. So for those naman who are very much eager, okay, for their babies to be circumcised during that period, no, newborn, meaning during the same confinement as the mother or before the one month of age, no, possible din po yon, no, and we call that neonatal circumcision, but with the use of GOMCO. So with the use of that special metallic stainless device that would render the circumcision sutureless, no, wala pong tahi. Again, my point there is again for the Dr. S mentioned about the elective. They should be elective, and it's usually culturally related, no. And I have to add also that this is also has a religious background, no, especially for Christians and also for the Jewish people, no. They really want their babies to be circumcised, but during the 8th day of life, no. During the 8th day of life, no, doon po tinuli si Jesus Christ, no. You can find that in, I think, Luke chapter 3 verse 21. Okay, so again, what is important in circumcision, especially especially during the summer period na madami pong tinutuli left and right. Pagka may eleksyon, madami rin pong mga invitation, no, sa ating mga politiko regarding tule mission or surgical mission. So, very important in this, no, for all the non-medical listeners, and you really have, no, for the practitioners, you really have to ask the history of bleeding problem. Okay. Um, Months ago, I have encountered 3 cases of bleeding problem who came to the emergency room, dugo ng dugo, hours after the circumcision. They were not able to extract or elicit in the history about bleeding problem. So the patient, tule mission, and because of the bleeding, the patient was diagnosed to have hemophilia. The other one naman is von Willebrand disease. So alam niyo yung very simple of way of asking the history, okay, abnormal bleeding parameter, bleeding tendencies, very important yan. Even if you request for the basic clotting time, bleeding time, sometimes you might miss it, no? Kasi you have to do the PT and PTT, no? Mas advanced na laboratory po. So again, it's very important, no, to ask for the risk factor. Kahit na po yan tule mission, we have to give them a quality, good service, no? Kahit wala na nga po silang kakayanan, pinansyal, no, para magpatuli. So let's offer them, no, a very good service, no, to be rendered. Even if this will be done by the medical students, the clerks and the interns, no, it should always be supervised, no, by a senior resident or even consultants present, no, during that mission. And it should always be explained, no, to the parents what are the possible risks and complications. Kasi kung magkaroon ng problem po at you were not able to mention to the parents, doon po nagkakaroon ng gulo. Nagkakaroon po ito ng mga demandahan like that, no? So we don't want that kind of scenario, no, in any surgical mission. Okay, so second one that was mentioned by Ate Esther is the inguinal hernia. And we really want to emphasize that the management, the operation for inguinal hernia is really to do the operation as soon as diagnosed, no? Kaya nga lang po, nagkakaroon lang ng a bit conservative approach pagdating po sa premature, as mentioned by Dr. Esther, around 60 post-conceptual age, no? Yung 60th weeks. Okay? Para ma-prevent po natin yung pagtigil ng kanyang paghinga or post-op apnea. Very, very important po kasi yung awareness of the parents that inguinal hernia, no, hindi po ito talaga yung pinalalampas natin, pinaghihintay sa wastong edad at pinaghihintay ng wastong timbang para lang po siya maoperahan. Ang pinakaayaw po natin ay magkaroon ng tinatawag na incarceration or pag-ipit resulting to strangulation or pwede ikabulok, no? So very important po yon na malaman ninyo, especially for our general practitioners or the frontliners, no, in healthcare system, and also to our friendly pediatricians, no. Ayaw po namin yung darating doon sa inyo ng sobrang laki na tapos hinihintay yung particular age para lang magpa-opera. So awareness po is very important. That's why we have this TBUP to let the others be educated, no, on the proper treatment of certain pediatric surgical conditions. The other one is undescended testicle, no, same as inguinal hernia. It can be observed, no, hindi yung meron kasi ako dati na nakita, nag-consult sa akin, gusto na siyang operahan, but it's not a pediatric surgeon, no. It's a surgeon in the province, no, gusto na operahan at the age of 3 months. So very important then for the pediatric surgeons, for the pediatricians to refer, this set of patients to us or to the surgeons present in your hospital. Kung meron pong pedia surgeon, better. Kung wala po sa province, any general surgeons will be able to handle it, no? So again, for undescended testicle, there is 6 months without a significant descent. Sabi nga ni Dr. S, you can already perform surgery. But for otherwise, more than a year, no? Pagkatapos mag-birthday, I usually tell them to visit me in my clinic, no, and take a look. But during that, I really observe them during the follow-up before reaching 1 year of age. Because after a year, okay, and the undescended testicle is still there, there's only 1% chance of going down. Okay, and we don't want to have the possible complications of undescended testicle, no? Ang una-una nang sasabihin at iisipin ng mga magulang, baka po kami hindi magkaapo. Totoo po 'yon, infertility. But that comes second only, no? After the most fear, no, that we really look at the complication of that is the degeneration into malignancy. Pwede po siya maging cancer, no? So yun po yung ating iniiwasan. Next is the intussusception, no, that was mentioned by Dr. S, na kung talagang mabilis na recognize, no, immediate recognition, early treatment can be done. And if it is really early, other kinds of reduction, no, yung tinatawag sa saline, yung hydrostatic, yung tinatawag na air, no, and also yung tinatawag na barium. So these are all possible modalities, no, that can be done if intussusception, an early intussusception can be detected, no, recognized, and managed in the emergency room. Okay. Regarding the blunt abdominal trauma that was mentioned also, yung high index of suspicion na tinatawag po namin, no? Minsan hindi po talaga magsasalita yung bata, iiyak na lang sila. And then you have to look at the any marks, no, doon sa kanilang katawan. And if you think yung batang makulit ay batang naging tahimik, oh, that is something to be suspicious, no? So pagka ganon, you can bring your child to the emergency room. Primary care physicians there will be able to assess, and probably a request for imaging modalities. And for imaging modalities, yan yung mga tinatawag na pwedeng ultrasound, pwedeng CT scan. Again, it was mentioned that in blunt abdominal trauma or any in pediatric surgical patients, we are again conservative, no? Unlike in adults, pag may dugo, na-ooperahan na. Pero sa bata, kahit na presence of blood, no, doon sa abdominal cavity po, pwede po itong ma-monitor by means of blood transfusion, correction, monitoring, no? Kung magiging stable po siya, then surgery might not be needed, no? Then let's go to the last surgical condition that was mentioned by Ate S is the acute appendicitis, which is a very common surgical conditions in pediatric patients. Yes, I agree that the gold standard is really operation, no? But it is very important here to emphasize, to our medical students, to the clerks, and to the interns, residents, that a very good history and PE alone, okay, will be able to give you the correct diagnosis. If you are quite in doubt, then additional laboratories and additional imaging studies can be requested. Hindi po tayo dekahon na pag sa ER, abdominal pain, CT scan agad. No, nawawala na po yung ating clinical eye na tinatawag. So, as physicians in training, let's practice that. No, let's hone that very very important skills, no? Yung clinical eye. When you request naman, when you deal with patients who are quite special, no? Yung medyo may konting diferensya sa pag-iisip, no? Ganyan, yung mga autistic, ganyan. Okay? Dito po, I believe that CT scan is really needed, no? Hindi na po ito yung history and PE, konting history and PE, but of course they are not cooperative, no? They are not really reliable, no, in the information that you want to extract or elicit. So pagka ganyan, indicated po na talaga yan, no, na magkaroon kayo ng CT scan. And Dr. Esther also mentioned about ano ba yung mga hinahanap natin na clinical CT scan findings, di ba? Yung enlarged appendix, no? Sinasabi niyang border is 6 millimeter, more than that, 7 is already enlarged. But you need also to have the presence of fat stranding. Fat stranding is synonymous to inflammatory process. So pwedeng malaki appendix mo, pero hindi naman siya namamaga, that can be observed. Ibang usapan kung meron po siyang fecalit o yung parang may pupu sa loob ng appendix because that is already a walking time bomb, no? Okay. Sometimes you will also encounter patients na masakit ang tiyan pero sa CT scan normal. Meron din naman po baliktad. Hindi po masakit ang tiyan pero malaki po yung appendix pero hindi naman namamaga. So, sino po ang kailangan sundin? O sino po bang kailangan operahan? Yung CT scan ba, operahan nyo? O yung talagang bata na namimilipit sa sakit? So, dito po pumapasok yung tinatawag na clinical judgment. And in the clinical judgment, what is important here, okay, is your physical evaluation. And very, very important is your explanation. Explanation to the patient and most importantly to the parents. To the parents, to the lola and lolo, and to the barangay of the family. Usually present lahat yan. Because what they need to know, kunyari hindi nyo siya inoperahan, kahit na meron siyang enlarged lang but no fat stranding, walang pamamaga. So, sasabihin nyo lang po sa kanila na ito po yung dapat i-observe, hindi ko po siya operahan, ito po yung dapat i-observe, these are the possible risks, and if ever you encountered these signs that would recur, and then go to the emergency room right away. No? Okay, very important yan. Diyan po kasi nagkakaroon ng misunderstanding that might even lead to a medical legal problem. No, we don't want that. Okay. So for the NOM, okay, or the NOTA, non-operative management of appendicitis, or the non-operative treatment of appendicitis, which gained popularity during the pre-pandemic and especially during the pandemic, during the peak of pandemic, no? Kasi takot po sila lahat na magpa-opera and ayaw nilang pumunta sa ER. Ang pupunta lang po talaga sa ER dyan, yung mga talagang putok na o ruptured na, no? Na hindi na kaya talaga ng bata. This is a very important topic, no? Because before, when I remember when I attended the American College of Surgeons way back pre-pandemic around 2015, no? There was a lecture, no, that was presented for adults and pediatrics. And at that time, no, maganda po yung yield, no, for adults. Maganda yung outcome, acceptable. But for pediatrics, they found out a lot of complications, no? Medyo high risk sila at that time. So the recommendation at that time is really for pediatrics, 50-50, no? Not that enough data pa to support the management of non-operative. But after pandemic, and with the UPPGH Division of Pediatric Surgery, I'm very happy that they spearheaded this management of NOM in children. And during the last inter-hospital PSPS presentation, it was also mentioned there and discussed there during their presentation. So Dr. S also mentioned about the inclusion and the exclusion criteria for non-operative management of appendicitis. With that recent inter-hospital conference that we had a week ago, so we were already thinking of having this procedure, the NOTA or the NOM, to be also implemented in other training institutions if ever they will have a similar criteria, inclusion, exclusion, or they would have a different criteria to be implemented. And I hope that someday, after collecting all the data, the outcome, everything of this NOM, NOM, the Philippine Society of Pediatric Surgeons will be able to come up with a certain clinical practice guideline. But we want to see, of course, the results. The results will speak, okay, for its success or failure. But I'm very happy that this was already being done in UPPGH, and this will be an eye opener for all physicians, especially for the pediatric surgeons, to adopt, for their private patients also. Okay, so I think what is important in this webinar is for the audience really to delineate what is really essential, needed, and urgent procedures or operations can be done on their children, and what are also the conditions that can be managed conservatively, so that awareness, knowledge is very important in order to prevent complications or advanced diseases. I think that's all. Thank you so much.
Wow, okay. Thank you so much, Dr. Bong Tuason. Maraming salamat po. Marami po tayong natutunan.
Thank you, Dr. Tuazon. I think in-emphasize si Dr. Tuazon yung important points of the lecture of Dr. S. Sagil. And then, Raymond, I think very important yung isang point ni Dr. Bong Tuazon about clinical assessment done by the doctor and the explanation about the assessment that should be given to the caregiver or to the parents of the children. I think that's very important skill that all doctors will have to really develop and hone when they are during the training and during clinical practice. Thank you po, Dr. Bong Tuazon.
Thank you.
Yes, I agree po. So just in the interest of time lang po, we will shifting towards our Q&A. But before that, we just have a very quick public service announcement for today.
Ay, ate, gusto ko nang lumabas at makipaglaro.
Eh di ba magkakasakit daw tayo kapag lumabas?
Magpe-face mask naman ako eh.
Kahit na, hanggat wala daw tayong injection, hindi tayo pwedeng lumabas at maglaro.
Ano ba yan? Takot pa naman ako sa injection.
Huwag ka mag-alala. Parang kagat lang daw ng langgam yun.
Talaga? Eh natatakot pa rin ako.
Eh di sabay na lang tayo.
Pa-injection?
Oo, syempre. Loves kita eh. Para makapaglaro na tayo.
Dahil mahal ko kayo, magpapabakuna ako.
Kaya mga bata, magpabakuna na kayo.
Stay safe and stay well. Mga bata, magpasama na. sa Bakuna Center. Thank you so much, VVUP, the COVID Communications Public Service Announcement, just one of the many creative outputs of the webinar team to push for COVID-19 vaccination. So please share this video clip in all of your social media accounts. Stay safe and stay well. Magpasama na po sa Bakuna Center. Okay? I'll let you ask the very first question, Dr. Dion, to our speakers po.
Okay, thank you, Dr. Raymond. So maybe we can request our speakers to turn on their videos. Dr. Tuazon also. Thank you, Dr. Raes. Siguro I'll shoot the first question, no? And this is, I think, we need to answer the title of our webinar, Bata, Ligtas bang Ipa-opera? And from the talk, mukhang alam na natin yung sagot. But of course, we want to hear it from from our guests. Dr. S. Nakamute po kayo, Ma'am S. Please turn on.
Safe ba o ligtas ba pa-opera ang bata? Yes, with qualifiers, with proper
qualifiers,
preparation,
correct.
with proper assessment, no, and in the hands, in the care of the trained individuals. Yes, malaki na ang in-improve ng healthcare ng pediatric population. Think this way, hanggang nasa loob na ng tiyan, pwede nang operahan. Okay? It has gotten to that, na pwede nang operahan. So, we are more geared towards correction of congenital anomalies, no? Identification, early identification para early ang intervention. Importante talaga yung assessment. Kasi kahit na ganong, di ba, huli man at magaling, wala na pag late, too late, wala rin, ano? So, kailangan timeliness din is of the essence. So, I think, yes, very safe na ngayon.
Thank you, Dr. S. Dr. Tuazon, meron po ba kayong dagdag sa mga qualifiers na sinasabi ni Dr. S?
Yes, I totally agree with Ate S, no, regarding that. Safe talaga kung prepared, no, ang pasyente. That's why yung awareness ng mga magulang na ang bata o ang anak nila ay may karamdaman, that is one. Kasi doon magi-start na may problem yung bata, to recognize that they can send the patient to the emergency room, no? And once in the emergency room at ito naman ay ma-diagnose, yung tinatawag na pedia clearance na hindi na siya clearance, it's a preoperative pedia risk evaluation ay very important, no? And of course, in the hands of pediatric anesthesiologists, especially if you have kuting at very small na mga bata, ang pinakamaganda diyan is the pedia anesthesiologist, no? And the pedia anesthesiologist, the pediatric surgeon, no, they will always work hand in hand, okay? There should be a collaboration in the group, no, in the surgical team. And they should always talk and explain everything. Explain everything. Very important to establish a good rapport so you minimize other problems. Safe pagka may preparation. Agree. Thank you.
Thank you, Dr. Tuazon. Dr. Raymond, do you have any question on your end?
Question that I have po, two questions. This one, we'll ask it from Dr. Joseph Tortona. When is the best time to surgically correct cleft lip, cleft palate, combined cleft lip and palate? How many stages does it take daw po? For Dr. Sagil.
It's usually the plastic surgeons and yung ORL, yung tinatawag na ENT doctors, otorrino who do this. But meron mga dictum yan. Remember sinabi natin kanina, yung 60 days post-conceptual age. Sa Pilipinas, usually, the plastic surgeons follow the rule of tens nila. 10 kilograms, no? 10 ang hemoglobin. Pero actually, sa pediatric anesthesiologist, you can safely deliver anesthesia with a hemoglobin of 8. Sa France, dahil daw affected, merong mga studies na ganito sa France, sa cleft lip, para na-stress daw ang mga nanay, na-depress. Kaya hindi sila nagpapauwi ng pasyente na may cleft lip. Kasi ayaw nun, mahirap i-feed. Well, for one reason, one very important reason for clefts is difficulty in feeding. But the general rule is 3 months and above ang mga cleft lips, depending on the severity. Cleft palate is longer, is later, around 1 year, 1.5 years. The reason being, you want to do the surgery before speech is developed. Kasi pagka nagsimula na yung speech, ang hirap mabago. Ang hirap mabago yung nasal speech, yung ngongo na speech. So, dapat dyan din maaga. Pero early ang consultations dapat.
Early consultation. Very important. And since you talked about anesthesiologists, Ma'am S, question po is, mas delikado po ba ang magpa-anesthesia sa bata kaysa sa matanda? Mas mabilis ba silang, I think mas mabilis daw po silang gumaling or something if after they have undergone anesthesia. I think general anesthesia ang tinatanong po for this one.
What I can tell you is, maraming general anesthesiologists, yung natapos ng 3-year program, who do not like touching infants and children. Marami. In fact, yan ang major reason kung bakit hindi nagagawa yung mga baby surgery sa mga smaller hospitals sa government. Kasi unang-una, bukod doon sa delicate condition ng mga bata, usually emergency surgery. Pangatlo, di ba sa matanda, lalagyan mo ng gamot 500 milligrams, 50 milligrams, dekahon. Sa bata, Diyos me, kanya-kanya po. May lahat may calculator. Na lahat kinakalculate, kada gamot kinakalculate. Kada isang bata, nakita niyo naman, iba ang size ng, meron tayong maliit na 2-year-old, meron tayong malaking 2-year-old. Kung makikita niyo lang yung armamentarium ng pediatric anesthesiologists, they have all these various tubes. Iba-ibang klase sa sizes ng tubes. Iba-iba ang sizes ng mga tinatawag natin na airway. No? Kasi malaki ang variability pagdating sa bata. Tapos, yung sinasabi mo kanina na mas pwede ba may mangyari, na sabi na, I alluded to it earlier on, yung post-conceptual age, post-operative apnea, but this is for neonates and infants. Later on, mayroong mga titawag tayo, di ba mga bata madaling magkaroon ng infection, respiratory, mga bata ngayon ubuhin. Sa anesthesia, sakit namin yan, yung nag-aano kami ng mga pasyente na nagkakaroon ng hyperreactive airways. So, nagkakaroon ng bronchospasm. So, that's a very unique thing that happens primarily in children, and your anesthesiologist should be very adept at how to handling, correcting these problems, intra-op and intra-anesthetic period problems.
Mahirap pala yun, ano? Dr. Dion, go ahead.
Yeah, we've been talking about the doctors, our pediatric surgeons, general surgeons, and also the parents when they should bring their kids to the hospital and all. But we also, I think, need to talk about the kids themselves who will undergo the surgery. So ang question ko po sa ating mga experts here in the panel is, how do we talk to the children, especially if, makakaintindi naman na sila, hindi sila yung mga neonate na baby talaga. But how do we prepare them to that actual operation? Meron ba kayong mga strategy or ano po yung approach nila?
Mong, you want to go ahead? Ako ba?
And anyone can
Okay,
answer that.
ganito. So we're talking about children na nakakausap na. Kasi wala namang problema kung 2-year-old, 1.5-year-old. But I always say, napaka-importante ng primary caregivers. Number 1, paano ka magtanong sa anak mo? May masakit? May masakit? Ibig na, what do you feel? No? So, how the parents react, behave is very important. And it has been a constant observation over my more than almost 3 decades of practice na pag ikaw a caregiver, whether caregiver na nga, di ba, carer na tawag natin ngayon kasi it can be a parent, can be a grandparent. No? Huwag mo tatakutin yung bata. Huwag mo gagamitin, sige, bibiyakin ka ni doktor. Huwag kang magulo dyan, bibiyakin ka ni doktor. So the language that you use, how you prepare your child is very important. Pag ikaw palang pinamit mo na akong panakot, ang hirap, my job becomes set up. Huwag po kong gawin panakot. I'm supposed to help the child. I'm supposed to be yung kanyang angel. Okay?
Sa police na lang, no, Doktora?
Yeah, o sa police na
Huhulihin
siya
ka ng
matakot, tsaka general. Okay. Pero pag tayo, wag gagamitin panakot ang doktor. Kasi takot sa injection, di ba? Sige, tuturukan ka niyan, mga ganon. So, number 1 yan. We tell the parents na don't scare the child. Kasi importante yung communication. That is why I keep on emphasizing. You communicate that there's something painful, there is something wrong with you. We have to check it out. You have to correct it. Alam mo, number one ko dyan na example, yung mga 6-year-old na walang butas ang puwet or may hair shrinks tas may colostomy. Takot yan. Hindi mo yan how can you do a rectal exam? No, you're trying to talk to the child, hindi maintindihan. But mga approaches ko diyan is, ano ka sa school nagpupupo? Baho daw. Number two, gusto mo ba may ganyan ka lagi? No. I even asked them to make contracts. Kasi ang mga surgeries na yan, merong mga ah, post-op, meron pang mga anal
Post-op
dilatation, may mga
care.
clinic kang ano diyan, may mga clinic na interventions ka eh. Alam mo, pinapagawa ko sila ng kontrata. Yung 'pag marunong na sumulat, pinapapirma ko. Papayag ako na susundutin para hindi para mawala na po ang colostomy ko. So again, use positives. You emphasize the positive, what is going to be better, the benefits of what you're going to do. Do not dwell or emphasize the negatives. Kasi kung sabi mo, masakit yan, tutulog ka na, sige, meron pa ako narinig dyan, will hit the chan. No, 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 don't. Okay. So, kaya sabi ko sa inyo, magaling ako mag-bribe eh. Kasi depende nga sa age yan eh. Yung bribing, like allowing them to use the cell phone or having games after a procedure, common yan sa mga oncologic patients. Kaya nakita nyo minsan pag mga onco patients, dahil recurrent, sunod-sunod yung kanilang stress from admissions, interventions, talagang minsan nasa setback yung kanilang development, yung emotional development nila nasa setback. So it takes a lot of work to make them feel na they should be treated as normal as possible, no? As according to peers. Kasi otherwise, masa-setback mo talaga. Yung akala mo 6-year-old na, so sobrang dalas niya nasa ospital, bumabalik siya sa 4. Nagre-regress yan. Magre-regress yan. So it's very important that you know how to handle kids very well. Magaling ako sa positive feedback.
Thank you, Dr. S. Dr. Tuazon, do you have any
Yeah.
additional
If I may,
strategies?
yes, if I may add, no, communication with pediatric patients are really challenging, no? Hindi naman kasi sila nagsasabi ng aray, masakit ito, ganyan. So talagang you really need to observe the child, no? Kung ang mas close siya, for example, kay yaya niya, sa caregiver niya, okay, siya yung pasamahin mo. Okay, number two, you really need to devote your time, no? Pagka siya ang kasama mo, talagang iiyak lang yan. Pero sometimes meron ako mga dalang mga toys, ganyan, no, pang-distract. Once na-distract mo na siya, depende sa age, ha. Of course, yung mga infants, wala na yon, di pwede. But for the toddlers na 3, 4, 5, yan, pwede pa yan, no? Kasi minsan, ang hirap examinin ng tiyan nila. Kung nakita ka na lang, nakaputi, o iiyak na sila. So ako, nagtatanggal ako ng gown when I go inside the room. Then I pretend to be somebody else na friends, no, friend to them. So magdadala ako minsan ng ibang toys o ibang gadget na may mga sounds, merong lights, ganyan. And then pagka napakalma mo na sila, then that's the time I can do the examination, evaluation. Pero meron talagang very challenging, no, na pagpasok mo palang iiyak na. Pagka ganon, I do not force, no, myself to do the exam. Sometimes I will go out and then wait for about 20 minutes, 25 minutes, and then enter the room. Minsan, pagka nakita kong tulog, hindi ko sila pinagigising sa parents. Sabihin ko lang, ganito, keep quiet, tapos kakapain ko na yung tiyan nila, yung ganon. Pero ililift ko yung legs, no, para mas malambot, no, yung tiyan. So merong mga ganong techniques na kanya-kanyang pediatric surgeons ina-apply namin. Ang importante diyan is ma-examine mo ng maayos yung bata na hindi umiiyak. And of course, yung sasabihin mo sa kanila, just do not cry. Tatanggalin natin yung masakit sa katawan mo. You will just sleep inside. After that, you will be well. You can already eat. Naka-NPO kasi sila eh. So after that, ano nang gusto mo? Mag-order na tayo sa delivery, no? Fast food delivery. So naka-ready na sila. Gagawa sila ng wish list. Kung ano yung mga fries, burger, ganyan, kompleto. Yun yung mga pang-bribe, no, doon sa mga patients. But in addition, Dr. Raymond and Dr. Adion, to the first question about the the cleft lip and palate conditions, ang pinaka-authority dyan, as what Dr. Esther mentioned, would be the plastic surgeons or the ENT specialist, no, na merong subspecialty with this condition. Aside from the what Dr. Esther mentioned about the criteria, ang very important din dito for the pediatricians, no, is to recognize also the problem of tongue tie. Okay? Tongue tie or yung tinatawag na ankylosing. Kasi merong mga tongue tie na talagang obvious, no, or lip tie na very, very obvious, na if diagnosed during that time, pwede mong sprayan lang yan ng lidocaine, then you can do electrocautery to release. Pero if it is unrecognized during that time, no, newborn, lumaki, nagkaroon ng speech problem, nabulol, no, ang mangyayari dyan, ang problem dyan, since late ang diagnosis, the treatment would be also again the same to release it, no, but under sedation na sila. So recognition is very important. Thank you.
Thank you, Dr. Tuazon. So, as mentioned, and we would like to emphasize it to our parent or care audience, no, recognize the problem early so you can already seek consult. If there's no surgical indication, the doctor will be able to advise appropriately. Pero wag naman pong patagalin, kawawa naman pong ating mga bata, no? Doc Raymond, meron pa po tayong question?
No more questions, Dr. Dion. Maraming salamat po sa ating very, very knowledgeable po na experts po, no? Perhaps we can go ahead and answer po our two very difficult questions sa ating fun quiz segment. Our first question, can we have the Slido and Zoom on the screen po? There we go. Sige po. Okay. For our very first question, Ma'am S, ano po, is it true or is it false? Any surgical operations or procedures indicated for children, pwede pong i-postpone until they are of school age?
Wag naman. Wag naman. Only a select. In general, gusto natin, tandaan natin na return to normal. Return to normal ang dapat na bata. From not normal to normal. Kaya as soon as possible, mas maganda.
Ayun. Okay, for our...
Okay.
For
Dr.
our...
Raymond, you know,
Yeah, go ahead.
sa poll natin sa Zoom, marami naman nakasagot ng false.
Correct.
Although dito sa Slido, mas maraming nakasagot ng true. So, almost, pag in-average natin, okay na. Okay.
Opo.
Thank you.
Okay, for our second question, true or false din po, there are cases po ng appendicitis sa mga bata na pwede pong i-manage nang hindi inooperahan, ka-manage o non-operatively, Ma'am S.
Yes, definitely. Meron mga kasong pwedeng operahan na hindi operahan. Okay.
Okay.
Basta bantay. Bantay sarado.
Bantay, nakabantay
Oo.
po. Okay. Ma'am S, thank you so much. Sir Bong, maraming salamat din po. Please take this time to gather your thoughts and come up po with what you think should be your maybe parting messages, final messages po sa ating audience. What you think the audience should take away from this webinar, from your talks. While you are doing that, we will be launching ito pong panel discussion poll or evaluation poll. Wala na po kaming, to our audience, wala po kaming hiwalay na sinesend out. Ito na po iyon. It's 5 questions, 4-point Likert scale. So we encourage everyone to submit your inputs po for this webinar po as we continue to improve upon our webinar series, which is now on its 173rd episode. Number 1, the panelists demonstrated thorough knowledge of the topic. Number 2, panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists use appropriate language, technical medical jargons adequately explained. And finally, the panelists contributed to new perspectives and knowledge on managing various key health issues. So we will not be closing this until the end of the webinar as we move on to the final messages from our speakers. Go ahead, Dr. Dion.
Okay, maybe we can ask first Dr. S. Sagil before we call Dr. Bong Tuazon for the final words. Go ahead, Ma'am S.
Hi. I think we've had a very fruitful webinar, and my objectives have been met to introduce pediatric surgery and to show that, alam nyo, merong pediatric surgeons, pero limited pa rin ang supply sa Pilipinas. No? Marami sa amin nandito pa rin sa mga urban centers. Very important is we take care of our children. No? We will emphasize the prevention. Prevention of problems, kung kayang ma-prevent yung mga problema, why not? Early detection, early na seeking yung ating health seeking behavior sana ma-improve natin. And then yung pangatlo, syempre, sana nga pag dumating tayo sa mga ospital ay mapagamot natin ang ating mga bata sa tamang panahon. Yung timeliness noong intervention, sana ma-improve natin. Working in government hospitals, I know that there are long lines of patients who need to undergo surgery. Some of them have been waiting for surgeries for a long time. And I'm really praying for that day na when somebody needs an intervention, magagawa. No, within a very reasonable period. Masaklap kapag ka ikaw ay nag-aantay na ma-repair, na magawan ka ng butas ng puwet, pero 6 na taon ka na, since 1-year-old ka, pumipila ka na. No? So, sana, no, yung ating healthcare system, ma-improve din natin. We're working at it, di ba, Bong? Dumadami na ang aming training programs. Kinakalat na
Yes,
namin ang pediatric surgeons para
masaya.
lang matulungan natin ang ating mga kababayan. Thank you for the opportunity to speak about our specialty.
Okay, thank you, Dr. Reyes. Next, we call in Dr. Bong Tuazon for the parting words or final words.
Okay, so I think I want here to emphasize na for the parents, no, please know your children well. I-memorize nyo po ang kanilang ugali, ang kanilang galaw. No? Because kayo po ang makaka-recognize kung meron po ba silang high threshold for pain, mababa ba ang threshold nila sa pain. Kasi dyan po nagkakaroon abdominal pain. Pero mataas ang threshold ng pain sa bata. So hindi siya nagko-complain sa parents niya. Okay? Pero nung nakita ng parents niya na itong playful, makulit na bata, ngayon ay nakahiga na lang, nakaupo na lang, hindi na nagalaw, yung matakaw, hindi na siya kumakain, nabawasan na, there is something wrong with your child. So recognition of a certain problem sa anak po nila ay napaka-importante because this will be red flags. No? Ito po magti-trigger sa inyo na may problema anak ko, may sakit anak ko, kailangan ko siyang dalhin sa ER. And that immediate recognition will result to an early recognition and treatment of your children. And if you have early treatment, the success and less complications would happen. So very important yung knowledge and awareness. No? Kung hindi naman po magawa dahil ang mga parents po ay busy, turuan po natin yung mga guardians, yung mga yayas, o yung mga titas, o lolo and lolas, na ano po ba yung kailangan natin observe habang wala sila at busy sa opisina? Ano po ba yung mga dapat iwasan na mga pwedeng sakuna at ito'y mag-result sa isang debilitating disease? No? What am I driving at here is burn. Okay? Scald burn. Kape. Ang daming mga kape, scald burn patients na ang kape ang dahilan. 95% history. Yung kapeng inaabot ng batang 2-3-year-old toddler na nag-e-explore. Lahat aabotin, nasa table, nasa silya, lahat yan. And the other way naman, yung mga yaya na hindi aware na yung mga heater, yung mga pinakulong tubig, lahat yan. So ayaw natin yung sa huli ang pagsisisi. Ang gusto natin ay yung prevention ng isang trahedya na sakuna. Okay? Na magre-result po sa isang major operation. So yun lang po. Salamat.
Napakaganda. Marami pong salamat, Dr. Bong Tuazon and Dr. S. Sagil. Dr. Raymond, are we going to share our evaluation results?
No, we'll have muna our synthesis
Okay.
and closing remarks to be delivered po. None other po, well, obviously you all know Dr. Stella Marie Jose, who's the head of the Office of Expanded Education and Training at the Philippine General Hospital. Ma'am Stella?
Thank you very much to our speakers. They both are very excellent, gave very excellent lectures. And I would also like to congratulate Dr. Esther Sagil for receiving the award from the Philippine College of Surgeons, the Knight of the Night. For your information, that is the highest award given to a surgeon in the Philippine College of Surgeons. I would like to emphasize in her lecture the common misconceptions regarding surgeries in children, because I think ito na talaga the gist of her lecture. She said the common misconceptions are number one, elective surgery, for example, for inguinal hernia and undescended testes, should be done when the child is of school age. So that was also mentioned in our quiz, and she said that this is a misconception. Hernia should be operated on once discovered, and delaying the surgery may have negative effects on the child. So the baby can have bowel incarceration or gonadal compromise. Another misconception is general anesthesia will cause intellectual deficiency in the child. Talagang misconception ito because newer anesthetics and gases and medications as well as techniques has already made pediatric surgery very safe for the children. And when pediatric anesthesiologists are all well trained, okay, mostly well trained. And number three misconception is pediatric clearance for surgery will ensure that surgery is 100% safe. So ang mas preferred nila, Esther, ay sabihin natin na pre-op risk assessment. That is the more important one. And the pediatrician and the attending physician must make a detailed history taking and PE and laboratory. So this will all make the surgery of the child or infant safe. Now, from Dr. Rodolfo Tuason Jr. or Dr. June, he mentioned about circumcision. Ang talagang indications ng performing circumcision is phimosis, paraphimosis, and recurrent UTI. So dito sa atin, uso yung neonatal circumcision and they use the gomco clamp for it. Ngayon, he also mentioned na may cultural aspect pala yan. Ngayon ko lang din nalaman, no? Because circumcision in the Jewish way was during the 8th day of life. And dito sa Philippines, usually nagagawa siya at birth. Ngayon, he also mentioned about tuli mission. Kasi maganda nga ito because maraming nakikinig sa atin na clerks, interns, and residents. No? So, yung mga tuli mission, we should offer good service, not because it's free, that we can do it parang haphazardly. So, dapat the clerks and interns must be supervised by their residents or fellows. And also, we have to explain mga procedures to the parents. Hindi lang basta gagawin ang procedure. He also mentioned about inguinal hernias, which must be operated on as soon as recognized because it can result to incarceration and strangulation. Lastly, he mentioned about undescended testes, and this must be addressed by year 1-year-old because delay in treatment can cause disabilities or also can cause cancer, according to Dr. June. So that's all for my synopsis. Back to you, Raymond and Dion.
Okay, thank you so much, Ma'am Stella. Maraming salamat po. And really very very lucky to have Ma'am Stella coordinate po no and this excellent lineup of speakers that we have had for the entire year and kasama na po doon. And congratulations pala Ma'am S for getting that very very high distinction po. Thank you so much for gracing us. Yun po. So for our next week's episode, we are looking at, I guess we are looking at, ito po, palliative care. So palliative care po, care of, I believe, from the Department of Family and Community Medicine will also, so we'll have Dr. Andrew Ang as well as Dr. Karin Estepa Garcia to be our speakers for next week's webinar. Also being shown on the screen, napakataas po ng grade. At least 94%, between 94 to 98%. They strongly agree with all of the statements po that are shown here. You will see it on the Zoom. So really, it's a testament po kung gaano po kaimportante. Marami po sila natutunan sa ating webinar topic for today, as well as kung gaano po kagaling ang ating mga experts for today. So on behalf of the webinar team, maraming salamat po ulit, Dr. Rasagil, Dr. Tuason, for sharing your insight for today's webinar. So before we conclude naman po, we want to share that all Stop COVID Deaths webinars are archived for viewing at the TVUP YouTube channel for everyone's convenience. Kasama na po dito ang ating SCD Shorts. Yun po ang mga short consumable videos na meron po tayo that you can share. Maybe you can while you're waiting o magpapatulo po, etc. You're commuting, waiting for your food or drinks po, no? You just go to www.youtube.com/TVUPPH or if you can open up your app and then go to TVUP, nandun po sa live tab po iyon. Okay? So those formally closes po our webinar for this week. Magkita-kita po tayo again next Friday from 12 noon to 2 p.m. It's a date.
Together, we can stop COVID deaths.
So keep safe, keep healthy, and see you online.